Hello, 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 and welcome to another edition of the Gaswa Outreach Show. I hope that you can see me and you can hear, and I hope that what do you call it, that internet permitting, that everything is going to agree with us this evening. Please, when you join, as we always say, that please, when you join, please share with friends, share with people. Let them come and come be part of this wonderful discussion. I'm super excited again that people are joining. Please, share it. Let me put the banners on so that reminds people that look. What we say is that every time you come on, as we say that, please like our page if you are watching us from YouTube, so that every time we come on, you get instant notification. And if you are watching us on YouTube, please subscribe to our channels and press the bell so that you get instant notification every time we come on live. So please make it a point to join us, and we're hoping that, as we said, that the internet is going to agree with us. Today we have an interesting topic, and we'll be going straight into the topic very shortly. We're hoping that our guest, who is running a little bit late in traffic, one of our guests will come and join us, but I believe that they would come and join us very soon. So please share it around, because tonight we're having a very interesting topic. We know that tonight we're looking at the issue of child and adolescent mental health. So tonight it's going to be an interesting discussion. We're hoping that everybody will be able to join us for us to have this conversation. Yes, so I'm waiting for your comments. I'm waiting for you to, for some confirmation that you can hear me loud and clear. We will be right back. Wonderful, wonderful, and welcome back. Again, welcome to the Gaswa Outreach Show. Yes, I can see some comments coming through. Yes, definitely. Inshraba, Jemima, good evening to you too. Yes, you are the first today to give us a comment. Please if you can hear me loud and clear, let me know. Because I'm the only one here in the studio. Yes, good evening to you again. Thank you very much for joining. And yes, people have started joining from Facebook, I can see. Please, when you join, share it around and let others come and join this wonderful discussion. Today, again, I'm super excited, again, that we have my co-host who is with me. I'm so excited. Unmute yourself, Ophelia, and say something to us. Hello, Ophelia.
Hi, Kweku. How are you doing?
I'm good. And you?
Good. Good to see you again.
Yeah, you're looking fresh,
Well, I'm trying my best.
What is your secret? I'm looking naked.
No secrets, just eat well, sleep well.
Wow. Wow, definitely. So tonight we have a topic going on today. Tonight we're looking at child and adolescent mental health. I mean, when we talk about mental health, what are you hoping that tonight we get from tonight's discussion?
Mental health is very, very dear to my heart, because what I always say is there's a thin line between being okay and not being okay. But it's all right. It's always good to be able to say I'm not okay, because we're human. So I'm glad that we're talking about mental health, but in particular to our children, because there's a lot of things that we do unconsciously that affect our children, and it's a long-term thing. That's the thing with mental health. So I'm happy that we're coming to this topic today.
Absolutely. We are a multilingual group. We are a multilingual association. We are the Ghanaian Social Workers Association. And what we say is that please contact us if you need any help, if you want us to come through to your Zoom platforms or your church platforms to come and do some preventative work. Please link up with us, and we'll be glad to do so. So please make sure you invite us. Yes, there are a few more comments that are coming through. Yes. Oh, Oh, Kofi Tokwe is saying that, hi, this is Glow Healthcare. We can hear you clearly. Wow. Okay. Thank you very much for that comment. Yes. Thank you very much.
Dr.
Let
Kofi,
me
can you
change my
please share
margin
the
a
page?
little
Can
bit.
you please share
Thank
the
you
page
very much
that
for those comments. That we can see those comments, and thank you for that you could hear us. That is wonderful. Right. So as I said, that the other guest is running slightly late, but we have our other guest with us, Mr. Dumenya is with us. So let's welcome Mr. Dumenya one more time.
Good to see you, Mr. John Dumenya.
Thank you very much. Glad to be here.
Great, and as I know that a few of us have seen you before, but some who are joining for the first time may not have seen you before. So, if you can quickly tell us what you do briefly, and why this topic is important to you, and then we'll start the conversation, and hopefully, Chantel will be able to join us soon.
All right, thank you. As you know, my full name is John Agbesinyale Dumenya. Yeah, you can tell clearly from the name that I'm a typical Ghanaian. But my current profession is social work. We are Ghanaian social workers based here in the United Kingdom. I've been in social work practice for nearly 16, 17 years now. I'm mainly in mental health. My 15 years old. As soon as I finished social work qualification, I got a job in mental health, and I've been in mental health since. I've been to childcare and back. I started with childcare in children's residential home first, and then in mental health, and then I've been to childcare again, and then now working in a sector called emergency duty team, whereby we respond to all social care emergencies. So you can see 999 is when you are in crisis point or you need urgent help. Now, social care 999, we respond. EDT, emergency duty team, we respond to social care 999. That's in the layman term, that's how I want to put it. So we respond to children, social care issues, adult social care issues, older people social care issues, mental health social care issues. I'm one of what is called approved mental health professionals. What that means is that I've got a special training and skills in assessing people's mental health, and with the aim of organizing support for them, either in hospital or in the community. So when somebody is critically unwell and they need intervention, and looks like the family or whoever is looking after them don't know, or they've reached their crisis point, then I'll be called, I'll go in, I'll organize 2 doctors, we go and assess, and then provide the care that the person needs at that point in time. And those care can either be we engage in other crisis services to support the person, or thinking that this person, maybe the current presenting risk cannot be managed in the community, so we take the person to hospital. Now, becoming necessary, sometimes we can take the person to hospital against their will. That is the key. When we talk about mental health act assessment, that's the one area that we need to explore. So we can take the person to hospital against their will. It means at that point in time, they are not in the right frame of mind to make decisions about their care and their well-being. So we will make the decisions for them. That's one of my roles at an arm. You can see there. And I'm also trained best interest assessor. We call it BIA, best interest assessor. That is under the Mental Capacity Act, whereby somebody is not able to make decisions about their care. We assess and make decisions in their best interest. Yeah, so that's what we do generally. So I'm a social worker, best interest assessor. I also train social workers, and I also train AMP candidates as well.
Interesting, Kweku.
Interesting, isn't it? This man is very experienced. So when we talk about today's topic, tell us why you think that this topic tonight is so, I would say, poignant and so appropriate for us and our community today.
Yeah. Ghana community generally, Ghanaian community generally, especially Black and ethnic minority communities as well. So we start from Ghana, Ghanaian as a community, and then widen it up to the Black and ethnic minority, and then the general population as a whole. When we are talking about children mental health, some people think that it is not existing, or it's people have different views about it, but there are serious mental health issues that affect children. And some families, unfortunately, because of lack of knowledge, they struggle to manage on their own, and they don't know what they're actually dealing with. So sometimes, right, unknowingly to them, because of the nature of the child's mental disorder, and they not knowing, they end up trying to raise that child like any other children that they have, or any other child in their community. And as a result, they end up abusing the child, and then we get involved. So it is important that we have this discussion with our community and educate our community about some difficulties, some differences that they can see in children that are not normal. And there are professionally trained people out there who can help families, parents, to parent a particular child that has a special needs. So it is important for us to educate our community that these are some of the things that they can see in a child. And when they see A, B, C, and D, they should be able to tell that this child needs more than the usual parenting skills that they have to parent this particular child. So today we'll be talking about children's mental health in general. So it's going to be general, because there are different type of mental disorders that children suffer from. We can talk about OCD, which is obsessive compulsive disorder, depression, anxiety, autistic spectrum conditions, post-traumatic stress disorder, conduct disorder, attention deficit, active disorder.
John, can I come in here? I think we're jumping ahead of ourselves in terms of going in there. Thank you for just doing that. But I just wanted first of us to understand what mental health is in the first place. But then I can see Chantal as well, so we might as well do that welcome before we go to the OCD, and because otherwise, if we don't understand what mental health is, then the types of mental health is another thing. So let's
yeah. All right. Okay. Thank you.
Hey.
Hi. How are you? Nice to see you. Nice that you could join us this evening.
No problem.
Can you just give us a brief introduction of who you are and your area of expertise or work, and then we can take it from there, and then we can come back to you about what actually is mental health.
Sure. Okay. So my name's Chantal. I am a psychologist, a counseling psychologist to be exact. And I have worked with children and adolescents for about 5-6 years now. So we've worked within the demographic mainly of like teenagers, but there have been like smaller children, so from the ages of about 7, and I got all the way up to about 25. I've recently started to do adults again, but so now I do everybody, but there was a good 5-year chunk where it's just children and adults.
Right, lovely. So at least we can get a bit of the children and how it transpires into adulthood from yourself. If we go that way. But Chantal, just to let you know, because we're a Ghanaian community, every so often we'll just have to say something in our local dialect. Don't take that personal. It's just trying to explain to the community what we've just said, because some people do need that help. Okay. Over to you. Thank you.
Okay.
All right. But before we move on a little bit, Chantal too has got a service, and we're going to be putting that on screen soon. Do you want to tell people a little bit about the counseling service that you also offer, so that if any of our listeners is looking for some counseling service, they'll be able to get in touch with you?
Yeah, sure. So I do offer counseling services. Majority of it is online at the moment due to corona restrictions, but that's helpful for people who are international as well, which I already do. I serve people in the US, I think one in United Arab Emirates as well. So you're more than welcome to send me an email. I'll send over like the email addresses and stuff, but you're more than welcome to send me an email, which is therapy@ino-v8.com. And we will definitely get you into some sort of program with myself or with somebody else, or you can contact on the number that's there. So 07801-756-321.
Thank you very much. And as we say in most of our discussions, if this conversation, bring any negative emotions or make you relive some of the, I'll say, awful experiences that you may have had in the past, please don't suffer in silence. Contact any of these numbers. And we are glad to say that most of our guests who have come through have services. So Isha Johnson, one of our popular guests who've been coming through, has got a service called the Luminous Counseling, and the telephone number is there. And our lovely Chantel, Shan for short, is also got the Innovate
Therapies.
Yes, therapy. Yes, thank you very much. So please make sure that don't sit there and suffer in silence. And these are, I will say, guests who've come and talked to us who are practicing and have these services there on offer for us. And I'm sure they'll give you a discount if you quote Gaswa. All right, wonderful. So without wasting any time, let's get straight into our conversations today. Yes, so today, as we've already said, the topic today for discussion is child and adolescent mental health. So we'll go straight and ask the first question. So maybe, Chantal, if you're going to start for us, if we say child and adolescent mental health, what is it, as Ophelia just said?
Okay, so the way that I would classify it, and the way that I think it's generally classified, is looking at the emotional, psychological well-being of a child or an adolescent. The only difference with children is that there tend to be some things that are very specific to children. So I'm not going to go into diagnostics just yet, because I think that that's something that we're doing later. But it's definitely looking at how a child is able to emotionally regulate themselves, how a child is maybe able to psychologically regulate themselves as well. So by that, I mean, if I get angry, is the thing I'm getting angry appropriate for me to be angry at? And to what level? So if say for instance, I don't know, my mother moves my toy, is that reason for me to go ahead and break the toy and throw it at her? Like, that's probably not an agreeable level of anger. The agreeable level of anger may more so be, oh, Mom, why did you move my stuff? Like, I really hate it when you move my stuff. And that might be more of an agreeable level of anger. So that's what we try to actually look at. That's what we try to actually look at. How children use their emotions, how they're able to express their emotions, and then how they're able to then act on their emotions as well. And psychological well-being in the same process as well.
Okay, thank you for that. Mr. Domenya, is there anything you want to add to that in terms of what is adolescent mental health, or child and adolescent mental health?
Yeah, I agree with everything that Chantal said so far. It's all about the emotional regulation of children and the distress of the mental state. And there are in mental health, or in mental health practice in general, we look at mental health in two dimensions: the medical model and the social model. The medical model, we're looking at changes that you see in a child. Yeah. Usually, the two professionals from the medical field, social field, they look at the child from the different perspective and come to the same conclusion or come to a compromise. So the medical model will look at a child and what's happening to the child right now and query what is happening and try to make sense of what is happening. Like Chantal says, the emotional issues. And the social perspective will come from what's happening in the environment of the child. That is called making the child behave in this particular manner. For example, social workers, we get called out because a child has said something at school or doing something at school, like a sexual behavior. Then automatically we are asking questions about what is happening at home that make the child behave in that particular manner. You know what I mean? So we are looking at the child from the social perspective, see what's happening around the child, to behave that particular manner for the emotions, as Chantal mentioned. presented in that particular manner. So we will look at child mental health in those paradigms, medical and social. So to speak to our listeners who are in a language that I believe they will understand, I would say these are the questions that when you are lamenting on your child, these are the questions that most people ask. So they are having trouble doing things. Like doing the normal tasks. Yeah, going to school is a struggle. Yeah, mingle with friends is a struggle. Having a rough day, always having a rough day. You're feeling down. Everything goes through tough times. No matter how long you had something on your mind, something is always on the mind of the child. It is important that you talk to someone. I must say, it's important that that child talk to someone. So there are issues like people can't eat, sleep, people come from their daily tasks, don't want to hang around with friends, don't want to do things the way they were doing usually. Yeah, they usually enjoy, they don't want to do that anymore. They fight a lot, as Chantal has mentioned. Yeah. Chantal used a toy, for example, as an example. So they're in a flight mode all the time. Yeah. Feel like they have no control of their emotions and it's affecting your relationship with your family and friends, especially. Those are the things that you see in a child. Yeah, have low or no energy at all. Feel hopeless, really numb, like nothing matters. Can't stop thinking about certain things or memories. Feel confused, forgetful, edgy, angry, upset, worried, scared. Want to harm yourself or others. Have random aches and pains, smokes, drinks, use drugs, hear voices. Those are some of the things that you see in children that parents complain a lot about, differences that they are seeing in their children. And to give you some statistics about children's mental health, it is said that in the UK, if you take 10 children, right, there is at least one person who may have a mental health issue.
Okay.
Yeah, they are, and then it says they are usually diagnosed between the age of 5 and 16, 15, 16. Yeah. 16. 75% of mental illness are thought to start before the age of 25. Yeah.
Okay.
Yeah. So sadly, it's often the case that children will go untreated with significant consequences to that young person's life, to their family, to the community. That is why we are having this program as Gaswa to educate our community so that people know and get the help that they need in time.
Thank you, Mr. Dumenya. Can I just summarize a bit for our community? In your nominee for Anaju me Mamaju, Yasa Baby Ghana Social Workers Association, and the topic na ban here pa maying a topic beer Yuna and Tiasie your friend child and adolescent mental health. Emre brain no ya na yese anipa no wa bodam na mum e ya bodam de nti ene ye de na ye keka na say enkoda ene emebu ne ememabu no omo mental health nti no omo di ye se na ebe ya me hu se na menka mental health ni wotwi mu papa but se adwen no ye nka se wa bodam na mum edie ne ha no nti abia ni su asesa ebi akoda bi wo ho akakra na ni buefu nyenye se ye bufuo kra no wo toto ne ho nyenye se obu obi no wa bono emre pi ni yese ya akoda no bi na eye no ye obi na ma ni bibidi ye enso etodo bi na ye yare a yese ye hwehwe mu enye se wa boda mu enye se obi na ma ni bibi edio enye se obi na ato na eduro na mum eye nyoma nkitinkitin bi ya na ye ntiase nti eno ne yeba betwetwe ho nkomo na eno na ye nua ba Chantal ba ye o kire yense ye ka akoda year ye hwese na oni nipa etna socially say oni ni nua no bi agro ne maame mo ye hwese na etede bi onye bufuo enye bibia na ne ra ho no wo su obi ani ni agro no ko ato ne ho ahye den mu da bi eno no nyina se hu se wo ba sesa emwa wo ho na eno na menua kwa ekude to ho mo the numbers bi to ho ye wi a be san de ato ho enzi se bibi ni na se wo ba esesa and na ho ne niare ho asori ye de na mum ehia se woni obi so be kasa adwen ho ahwe se me be edie na wo sesa na eno na ye nua John nso kire ye se UK hankwan nkwadaa so we nkwadaa edua baako bia ya na enko yie papa na sa diagnosis no between 5 and 16 years si yehu ne ntema yetumi de mu ahye mu na akwadaa no yehu say bia say ni ye ya aboa no ntem nti ma bonu ppp amamo nti bibie ni a mesrɛ mo fa mo question nto ho ne yenya no why eda wase.
Wonderful, wonderful. Thank you very much for that. And for that, I'll say the translation in our local language. You are quite competent in the translation. Thank you very much, Madam Ophelia, for that. Let's move on with the conversation. But before we do that, let's acknowledge those who have joined us. As usual, we want to say hello to all the various comments that have come through today, right from Jemima through to Togbe, to Laurietta, to Nanaya, Ampoma, Trudy. We thank you for coming through. Mr. Martin Luther King, our financial secretary. Obaya, who is our welfare lead, is also here. Mr. Pastor Bwampong, thank you for coming through. And we thank you for the various comments. Shelley, thank you for coming through. Our own outreach lead, Irama Angela Apia, thank you for coming through. All the comments that you've sent, we really, really appreciate. And as Sheila is saying, thanks for the translation. It was very straightforward. And Irama is applauding you. Irama is the expert in chief. So if she's applauding you, Ophelia, that means that you are spot on. Wonderful. So let's move on. Ophelia, let's look at the next area that we want to look at. I think they started by looking at that already. Actually, I think that John started highlighting on that. Let's give Chantel an opportunity to also talk about in the various ways in which children are affected by mental health.
Can be affected by mental health. Well, with my type of model, whenever I'd look at any person, kind of similar to what John was saying slightly, we look at the biopsychosocial model. That's the model and framework that I work from. So if I'm doing an assessment with a child, I will always look at their biology. So things that may have happened either from childhood in terms of like, were they born prematurely? Are they on any medications? Do they have any kind of issues with like prenatal addictions, stuff like that. So we look at the whole biology of the child, but also look at the social impact. So what's their environment like? What is their schooling life like? What's their home life like? What is their family like? What are their friends like? What are their interactions like in general? And then when we look at the psychological, we look at the actual things that how they process all of these things together. So the meanings that they then place upon that. So let's say, for instance, if a child was to be born into a household where drug addiction was happening, and the environment therefore means that they're probably, not all the time, but probably they may be on less income in terms of their family. So that's the social. I would also be looking at like how the child would be experiencing in school. Are they withdrawn, so on and so forth? And then what meaning do they then place on themselves? So does that then mean that, okay, am I not good enough because my parents now pick drugs over me, or my environment picks drugs over me? Does it mean I'm not good enough because now I'm finding it hard to engage in school because my household is like how it is, my environment is how it is? But at the same time, I'm wanting to do whatever it is that I'm trying to do, but at the same time, I'm still finding it difficult. So there's something within me that creates meaning to then say, okay, actually for this thing, I'm not good enough, or I'm not worthy of experiencing X, Y, and Z like other children do. So that's the framework that I would personally work from. So there's multiple ways, basically, from what I'm saying, that children can be affected. Normally for younger children, it is more so environmental than anything else. It can be biological, obviously, like for the things that I was mentioning. So prenatal addictions, growing up in a household where, actually that would still be environmental. So they grow up in a household where your parents have mental health issues. Trying to think of anything else now. So those, that would be the main things that I would foresee.
On that particular one, I just have one question.
Sure.
parental pressure, because we come, I know my colleagues from Ghana will bear with me. We come from a society where if you're not a doctor, you're not a lawyer. Quickly, what's the other one? Any engineer, that you didn't go to school, right? So there's a lot of pressure on the young adolescent. You have to become a lawyer, you have to become a doctor, you have to become an engineer. Forget the rest, right? The rest don't exist. So does parental pressure, can it lead to mental health in adolescence if there's no disposing factors there? I just want you to touch a bit on that.
Sure, no problem. Yeah, I definitely can. 100% it can. And again, it depends on the predisposition of the child. So if the child is predisposed to already having issues in terms of like how they manage stress anyway, sometimes that can then cause there to be extra issues when there's too much pressure that is applied. Having said that though, I think it depends on how the pressure is put on. If it's like, you must be an engineer, but then you're like, but I kind of want to be I don't know, a doctor of some sort instead. Maybe they might not actually qualms with that one, because they'll probably say, okay, if you're not an engineer, you're a doctor. But maybe if it's like, I don't know, a teacher or something like that, I want to do something else that isn't, that related to the area that you're pushing me into. Then yeah, it definitely can. It definitely can, because now you're trying to work against your child's agency. So you're working against your child's own concepts of self, basically. So within counseling psychology, we look at this idea of having a ideal self and an actual self. So when you're having your ideal self, if your ideal self is being placed by your parents to say, you are not an engineer, you are not a doctor, you are not this, you are not that, then your actual self then becomes flipped into something that's negative. Does that make sense? I'm trying to make it as simple as possible, yeah? So if you're not matching up, the further away we feel like we are from our ideal selves, the more unhappy we become. So if you're saying to your child, you must be a doctor, but they're not good at biology, then you're kind of working against your child's agency. If you're saying to them, okay, you must be a mechanical engineer, but they don't like maths, then it would be a problem as well.
So how does the mental forces the brain to twitch?
I'm sorry, say that again?
What triggers the mental? Because obviously the child is going against their ideal self. So what then triggers it? Is it how do you explain the trigger of that child then becoming something else, which we quickly will then associate with some person somewhere, somewhere?
Okay, so whenever I would say it's like me saying, okay, it's like if I said, I'm going to use this as just as a blatant thing. I said, I want to be a white man. I am so far from being a white man that would never, it would be nigh on impossible unless I had like a whole load of surgery and whatever else to achieve that, right? So if I'm saying that, okay, I want to be the complete opposite to what I am, I'm already putting myself at a deficit. So the meaning that I'm placing on myself is that what I am right now is not good enough. What I am right now is not supposed to be who I am. What I am right now, and then all of these different things, the further and further away you get. So if you have your ideal self, say over here, and you have your actual self over here, the further and further away you get, the more things like depression come in, anxiety come in, OCD come in. All these different things have room to kind of maneuver into your life or into your meaning or into your understanding of yourself, because you've got this massive gap between one and the other, and that's what triggers it.
Thank you.
No problem.
Mr. Dumenya. Mr. Dumenya, we can't hear you.
You can hear me?
It's a lot better now.
All right, okay. I just before I go through, I go to my list of things. I just want to put what Chantel said into perspective in terms of how we understand that. Now, there is something in our approach, social approach to mental health, we call stress and vulnerability model. What Chantal is saying is that, like the question you've asked, what Chantal is saying is that children have different biological makeups and different mental processing capacities, and they can take certain things so far. Some can take it longer than others. So if there's a parental pressure on a child, depending upon their biological makeup of their mind, it can trigger a mental illness to the point whereby if they are too stressed about what they are being pushed through by the family. For example, a child wants to become an actor and the father wants the child to become an engineer. All right. That child can only take that kind of pressure so far. Some children can take longer pressure, but if the child is vulnerable to pressure and the limit is reached, it's reached a crisis point, and the parents continue to push and it hit the crisis point, that can trigger a mental disorder for that child. I hope I'm making it simpler as possible. So that's one of the ways you can look at mental health, the way it affects. So stress and vulnerability. A child is vulnerable because of their nature, their biology, and then you put too much stress that they can no longer bear. They reach a crisis point, and then they become it hits a nail or the spot that it shouldn't be, and that destroy the child. So they tend to be processing things differently. They become because sometimes they internalize the issues that the parents don't like the way they are. They don't. Even sometimes it's about the way they look as well, and there are so many things that we can look into. So that's one of the areas. Biological, organic causes is one of the causes. The child brain does not develop properly from birth, and usually sometimes organic causes can be affected by the lifestyles of mom while the child is in their belly. So that is why social workers we are very concerned about pregnant women using drugs and alcohol and stuff like that. Yeah. Yeah, and then there are other ways that young people can develop mental health by trauma, torture, immigration, lifestyle of parents, poverty, accidents, natural disasters, divorce of parents if not managed properly, bullying at school, bullying in the community. Social media is a big thing these days. Yeah, people want likes, peer pressure, drug, alcohol. Relationships in general, lack of loving family, children comparing themselves to other children and not feeling loved. All right. I was saying earlier, there's something that I like to mention, though. It's important we mention this because when we talk about children mental disorder, we are just scratching the surface. We are just giving a broad spectrum of what a mental disorder is. There are detailed mental disorder we can look at in microscopic detail. So when we are looking at obsessive compulsive disorder, we can go into what is the cause and what are the symptoms and blah, blah, blah. Depression, anxiety, autistic spectrum disorder, post-traumatic stress disorder, conduct disorder, attention deficit hyperactive disorder, schizophrenia, and others. Yeah. So we can look at each one of them, the causes. But this what I've given is just a broad spectrum of what some of the causes, also what ways that children's mental health can be affected.
Thank you. I think Ishraba Mensma is asking, can parental insults on children lead to mental health?
I think Chantal can answer that better.
I love how you passed that basket real quick. Okay, so no, for real, it can. Insults can be something that stains for life. You know, like the saying, sticks and stones will break my bones, but words will never hurt me. Words are the things that linger the most. Like your bones will set back, hopefully. Your bones will set back. Everything else will kind of come back into place physically. But in terms of the words that are spoken, like that's the thing that can stay with a child for the longest time. There's actually a type of therapy that I do, which is called compassion-focused therapy. And it is literally to deal with just this. And with compassion-focused therapy, what it does is that it looks at all the negative stuff that you say to yourself, effectively, all the things that you kind of regurgitate back to yourself in terms of maybe things that your family has said, things that your friends, air quotes, have said, maybe things that your partners have even said to you. It could be absolutely anybody, parents, partners, family, friends, friend down the road, whoever, anything that people have said to you negatively that you kind of latch onto, it stays with you. And the whole point of compassion focused therapy is that we try to look at that and we try to get you to ungrips it. And the way that we try to do that is by trying to get you to meet yourself with the kindness that you weren't met with in that space. So when someone was insulting you, you were feeling a particular way. You had your own connotations or your own understandings from what it was that they said. And then on top of that, then you've come to then apply it to yourself. So there's people that I'm treating now. I obviously can't give too much details, but she's in her 60s and she's still suffering with things that she was told with when she was like 8 years old. It's things that do resonate with you. Even sometimes now, you might even have negative self-talk that you give to yourself. There's some things that I will do. And if I do something wrong, I'll be like, oh my God, I'm so stupid. And it'll be the first thing that comes to my mind. But it's actually somebody has said that to me at some point before.
Okay.
But that's why it's the first thing to come to my mind. And that's something that unfortunately we do insult our children quite a lot. Because we think that it's case tough love, and that's fine. I'm not gonna say about parenting their children, but like at the same time, be careful about what you say, because sometimes those things that you say stick more than anything else. Those things stick, and you can repair a smack bomb sometimes. You can repair, well, maybe not a smack bomb, but you can repair like a physical thing, but where you can't really like repair the things that you've said to your child and the words you've spoken over your child.
Absolutely. Let's look at some of the misconceptions and the myths around mental health. I always say that because we are Africans and we did not, start with the germ theory. We did not believe in the germ theory at the beginning. We attributed everything to supernatural powers, the things that were inexplicable in our communities. And one of the things that we know very well about is mental health. And actually, come to think of it, I don't know whether Ophelia would agree with me, but we don't have a positive image about mental health. We will say, "Nipa no abodam." It's a negative thing. We don't have a positive image about mental health. If we say that, it's like you are mad. That's what we will say. You are mad. And normally we attributed children who are going through challenges to bad behavior. So these are a few of the misconceptions. So perhaps maybe let's jump into some of the misconceptions that we know about mental health and how we address those things. So perhaps maybe if Mr. Demenya would want to start with that.
Okay. Yeah. So, in social work, we have something called child development model, where how the brain develops. I'm just trying to backtrack a bit about our previous question and then take some of the myths. So some behaviors are learned. So the child brain is formed based on the experience around them. All right. So some of the things that we tell children can affect the way their brain is formed, and that can form in the subconscious mind for a very long time. So therapy can help. Just to address the previous question. Now the myths we have, there's so many of them really. One of them is mental health problems don't affect me. Most people say, "Oh, mental health problems don't affect me. We don't have mental health problems in our family." Your busi amu there, you need mental.
That's
the language they use. And then some people say that we don't have that, but there is. I've just said that 1 in 10 young people in the UK are affected by mental illness, and in the US, this is 1 in every 25 are affected by serious mental illness, such as schizophrenia, bipolar, and major depression. Right? So that's one. And another myth is that children don't experience mental health problems. Children don't experience mental health problems. Again, that's something that we battle with in our community. And also, in our community, when a child is having mental difficulties or mental distress or emotional issues, and they are acting out, we label them as what? Abofraboni. Is that not the language we use? Yeah.
Children, yes.
And we end up beating the badness from the child and end up abusing the child. That is wrong. There is the fact is that even very young children may show early warning signs of mental health concerns. These mental health problems are often critically diagnosed and can be a product of interaction of biological, psychological, and social factors, which we've talked about before, right? Half of mental health disorders show first signs before a person turns into 14.
Mm-hmm.
So I'm already I just want to highlight the facts and then the myth to counteract the myth, really. And another thing that we say is that people with mental health problems are violent and unpredictable. This is also a myth in our community. Say, as soon as you label mental health problem, you are a violent person. You have some people you have a split personality, or you are unpredictable. So people tend to shun away from you. This is where we need to educate our community. That everybody, right? We have social care needs, health needs, and our health needs involve our mental health needs as well. All right. So every individual on planet Earth has social and health needs, and our mind needs are equally needs that need to be met. So mental health actually exists. Yeah. So we need to bear that in mind. Okay. Children do experience mental health. Now, there is evidence that people with mental health problems rather suffer abuse from others more than they affect others. Remember, the label is that people with mental health problems are violent and unpredictable, right? The research is saying that they are more vulnerable to be abused, to be subjected to ill treatment than the other way around. Yeah. In fact, people with severe mental illness are over 10 times more likely to be a victim of violent crime than the general population. Yeah, that's what the research is saying. And another myth is that people with mental health needs, even those who are managing their mental illness, cannot tolerate the stress of holding down a job. You see, that's another myth as well. Right. I always use this, especially when I'm in my practice. Anytime I've come in contact with somebody coming into service for the first time, police are worried. You always use this as an example. We used to have a director of a service who has a mental health issues and is on treatment. So mental illness is not the end of life. It's a condition. You can live with it. You can have jobs. Remember, he's the director of the whole trust, and he suffers from bipolar. He doesn't even mind reusing him as an example. Right. So you can go ahead. An actor called Robin Williams? Yeah. Some of these people we see on media, some have mental health issues. Prince Harry. Is it Prince Harry?
It is Prince Harry. Yes, and they support the charity.
Examples of people who are in the media who have mental health conditions or suffer some mental health problems, and they carry on living their life normally. Yeah. So there is so it is not the case that you cannot hold down a job if you have mental disorder. Yeah. There are other myths as well. It says personal weaknesses and character flaw causes mental health problems. People with mental health problems can snap out of it if they try hard enough. This is a very unfortunate statement. I always, I just say, really? I ask myself, really? You can't just snap out of it. It's a disorder that needs to be dealt with carefully. Yeah. So we say this to people, and then we be very careful what we say to people. Don't tell people they can just snap out of it. We need to be very empathetic and they understand. So this is what we ask of families. Don't beat mental illness out of your child. Yeah. Yeah, there are more. Even when it comes to help, people will say there's a myth that there's no hope for people with mental health problems. Once a friend or a family member develop mental disorder problem, he or she will never recover. It is not true. There's a recovery. Chantal can tell you a bit more about that.
Right, Mr. Duvenyao, we thank you, Chantal. We'll come to you in a little bit. Okay. Before we move to the next topic, I just wanted to quickly summarize. We've discussed two topics in between, and I'm doing just 2 minutes to just summarize it in tree. And no more, me sorry, say, mantra back on a kind of answer, ya next topic. Nanya and say, and your ben, ya. Emma enkoda any amaba one ranty no ya affect omwadua ya na ye kasa omabodam no na ebia ye boboy ne say etere bia akoda wo eyefunum kra ye nwo no se ne maame no mensa na ofifa nnuro ni nyoma etumi affect omwadua ni enyini yi si ye kanso ni ye hwe etere bia ye duro bi obi fa ye onyem efia ye nyi wom ana say ye kan community society ye nyi wom ebi so ye ko school ye ba ena ne ka ye hia pan say yen awofo no so enioma ya ye keka kire ye ma no to de bia na ka kire ba wo de wagimi o Mr. Mo enu nyina munyai because e sha akoda na dream a ebema wo abodam ena ye to de bi so akoda no ebi a wo pese wo sua ade o se me de me pese me ye nurse wo se chinchine a wonye nurse wo ye engineer Mr. Mo and also akoda it's me to fan a dream because near psychologist Chantel kan say akoda no wo yasan onu nyo peni o wo so wo ka say inti ma ekwan ade mu tintintin be ho na fan a dream na wo say na na bia wote baby no wo ye no so na wa usuban na ye ha wo ba no inti bibi ni na ye ka say ya yesre mo ne mo manent na se na mo nkasa na ye mo nye ne o mo so mpese omunyi pese omunyi a omo ye ne en support yo na ebi mu so kan say tere bia bibi e friend stress na efi so enkwada na iko school bullying enioma akoso yen hwe na nya abodam enye bibia ne say wa bodam na che say wuhu ne na wo bebo debi obi bodam no nche say wo bobu nipa na wo toto ne ma bobu nipa na emum na abodamfo mum ebre wo yensem yen na yese ye in quote normal nsem krasing omo abodam no emrenti am say mabobo sutu inti yen hwe next topic na ye kono any warning signs, early warning signs of mental health breakdown. Inti any in your man kitten ya you be who I try say near airquay akode and koyi inti yan one man answer I ding agency.
All right. Okay. So Chantel, we want you can touch on briefly on the some of the misconceptions you know about, and then also look at the early warning signs so that we know at an earlier stage how to detect some of these things. Please unmute yourself. You are muted.
Interesting. Okay, so no, what I was trying to say was that if I go back to some of the misconceptions, I was doing some voluntary work actually in a West African country. It was not Ghana, so I can't say this is necessarily a Ghanaian thing, but there was like some children that we had to end up rescuing from a exorcism, let's call. And the children were severely beaten and were starved for a few weeks, I'm gonna say, because they were trying to say that they were possessed and whatever else. One of them, quite clearly from when we were looking at them and assessing them, they had autism, quite a severe level of autism. Another child, it seemed as though she had a very specific type of OCD. I'm not going to go into it too much because I don't want to go into that stuff too much, but it's a very specific type of OCD. And the other two children, from what I remember correctly, I think one of them was previously addicted to, I want to say cocaine, or it might have been heroin. Her mom was addicted to heroin. She became addicted to heroin, which means that she kept lashing out really quickly. And so it was the other child, the other two children, both of them were drug addicted children. So I think sometimes when we rush to, like you were saying, supernatural understandings, and I'm a religious person, I'm a spiritual person, so I do believe in the spiritual aspects, but sometimes we need to learn to decipher between the two and when one is more appropriate than the other. It's like if a child came to you and said, "Mommy, mommy," or "Daddy, daddy, I broke my hand," you're not gonna say, "Okay, we're gonna get some olive oil, we're gonna pray it away, we're gonna ask God to take away your broken arm." If you would take them to the doctor, you take them to the hospital. And I think in that same kind of spirit, you should take them to, the correct people. And what was the other question? I'm so sorry. Like the early onsets, the early warning.
Yes, we're looking at the warning signs.
Okay. So if we're looking at the early warning signs of mental health issues, the generic ones, I would say actually John said them earlier. He kind of gave off like the entire psychometric scale for some reason, but it's basically like things like interrupted sleep, interruption in eating, doing things, or sorry, not having interest in things that they used to have interest in, or not doing things that they used to do. Probably becoming more withdrawn. On the flip side, though, you might have some children who become more extrovert. Again, there are swings and roundabouts with this one, but it's like sometimes you'll have children that become more extrovert. That I would say is actually more scary than the child who becomes more withdrawn. The reason why I say this is because there's sometimes way too many other factors that might be introduced, let's say. So if it is bullying, what is the nature of that bullying? Is that bullying a sexual bullying? Is that bullying something that, you know, they've been having the taken out of them for clothes? I'm just using bullying as an example. It may not be the only thing. It could be that, you know, people are causing them to want to become more of an extrovert, or if they feel that they're more out there, then, you know, they'll be left alone a lot more. There's research to even say people who have like tattoos, piercings, like multiple tattoos and piercings, and like really bright hair and stuff like that, actually have the worst levels of anxiety and self-esteem. We have numerous papers on that. So sometimes you can see the flip side come through as well. But I would say anything that looks like, so if your child is, let's say this is your child's norm. Anything that goes too far to the left or to the right, that's something that would give you cause for concern. And also having your child maybe talk about worrying quite a lot, or that they have nightmares quite a lot. Sometimes night terrors are a way of it coming through. Another warning sign that we look for as psychologists is also like biological issues. So I've already said sleeping, but sometimes wetting the bed. Some things like even, you know, not being able to hold their feces. Sometimes you can even have issues with making eye contact. That's actually a big one, I would say. When you find there's a child who finds it really hard to make eye contact, not like, you know, they look and then they look away, like straight down the whole time. They're not even trying to facilitate any face-to-face.
What about the cultural elements? Because in Africa and where we come from, we as a sign of respect, we told to not look people straight in the eye, and that we look down. So yes, I can you know, I can agree that even in this country that a lot of people misunderstand that a little bit, but you know, we just need to make sure to make a distinction between that. When we put your hands behind your back and put your head down when you're speaking to somebody who's elderly, can that be then misconstrued?
But I would say that if they're doing that to their own peers as well, then there might be a problem.
Yeah.
So I get it if it's someone who's older than you. I understand that there's various different cultural aspects to how people might converse. However, if it was something that you're seeing consistently, so I understand for an elder, because I know that in some other African cultures, like you have to touch the shoe. Like when you see them, like you literally bow down and you touch their shoe. So like there's very different things. So I'm aware of that. But I think if it's something that is consistent and it stays consistent, in terms of like your peers, you can't look at your peers in the eye, you can't look at a child younger than you in the eye, then that's when I would say maybe there's probably something that's cause for concern. Anything that you see that's outside of what your cultural remit is, I would say then, yeah, okay, fine, maybe that's a cause for concern. Or something that you need to probably think about. Also things like how they interact with school, I think is a good way as well. So there was a couple of years, 3-4 years, where I was working within a school actually. And one of the biggest things that would let me know that something's cracking off with a child, like something's happening, is how they interact with their school. So again, that norm thing. So if your child is norm, this is your child's norm. He or she is this way, but then they've moved too far to the left, too far to the right. Then that I would say would give you some kind of something's happening. So if this child used to be really, really good at English, let's say, and then all of a sudden they've forgotten how to spell, I would say like that's a really facetious example. But you know, if something like that was to have happened, then I would say, okay, yeah, that's something that you need to start asking questions like, what's happening? Are you okay? Why are you not finding this interesting anymore? What things would make it more interesting for you? Just trying to understand your child more. And I think that's something that I'm going to say within all Black communities, unfortunately, we don't always listen to our children. We do not always listen to our children. We kind of dismiss them. And I think a lot of the time we kind of say, oh, the way you're thinking is stupid, or you know, there's no reason for you to think this way, and blah, 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 instead of taking on what your child is saying. And sometimes I think that that's thrown to the wayside a bit too quickly. We're very dismissive very quickly. And I think that that's to our own detriment. So again, another fact that we have is that majority of Black people, when we hit to mental health services, it's usually within like the extreme version because we didn't deal with it somewhere down the line there. We're waiting till like, oh, no, we're kind of we've been disordered. Okay, the way that you're thinking, you know, you shouldn't be thinking like that, blah, blah, blah. And then you'll continue to start saying, you know what, I shouldn't be thinking like this. Continue. I shouldn't be thinking about this. And then eventually you'll end up in sectioning. Unfortunately, that's where it ends up. And by the time we start to unpick it within the hospital, we start to realize, oh, you should have had help when you were 10. You should have had help when you were 14. You should have had help when you were 16. And unfortunately, it's part and parcel is the dismissiveness, not just of our parents, but I'm going to say teachers as well. Some of them can be very dismissive of what a child experiences.
Wonderful. Do we want to bring Mr. Dumenya in before Ophelia comes up with the next one?
Yeah, I think this particular question is important to our outreach program, really, because this is why we do this program, for our community to know the early warning signs and get help that they need. Hit the nail right on the head, really. Because of our community not getting the support they need in time, our children end up receiving the heavy end of the mental health service. And when I say the heavy end, it means that Chantal mentioned being sectioned, right? Our community waits until it gets very critical and they can no longer manage. And the child is either a very high risk to themselves or to other people. And that's at that point, that's when the family asks for help. And when the child reaches that stage, it becomes very difficult to start therapy or initiate home treatment services that are there that can support that child in the community should the services know early enough. So it is important that we know these early warning signs and then take note of them carefully. So Ophelia, you have to do a bit of translation on this and make sure that we zone on this one. Yeah, the early warning signs affect children, their emotions, their thoughts, and their behavior. So emotions, thoughts, and behavior. Now, again, I have to stress that it's a long list of each diagnosis, as I've mentioned earlier. So this is just a general list that we can give you. When we are doing each diagnosis, if we are taking each diagnosis and looking into it critically and educate our community about this diagnosis, then we will look at each one of them, the early warning signs. So the one I'm coming to give you, I think Chantal has mentioned some of them, is the general early warning signs, which I will mention so that Ophelia can interpret to our community to hear, because it's important. So feeling very sad and down, confused in your thinking and reduced ability to concentrate is one. That's what some of the things that you see in a child. Excessive fear and worries, extreme feelings of guilt. Now, fear and worry is normal, but when it dominates the child's life, that's become worrying. Now, one thing that I need to say before I carry on with the list is that some of these things that I'm mentioning, the children can experience it on a daily basis or maybe a day or two and it's gone. Fine. That is not a mental disorder. But when it becomes persistently there and is dominating their life, and it's no longer the child. The child doesn't like the way they are feeling. I think I used this terminology before. The child doesn't like the way they are feeling. They complain to you, the parent doesn't like the way the child is presenting. The people around the child are concerned about the child. That rings a bell, right? So it means the child, Chantal mentioned, this is the middle, and the pendulum swing one way or the other. Yeah, that's what it means. So the child doesn't like the way they are feeling. The parents doesn't like the way what they are seeing. People around them have concerns, and it become consistent. They become a clinical issue that needs help. So extreme mood change is one of them. Yeah, high and lows. Chantal mentioned the high, which is a concerning part we be careful about. Withdraw from friends and activities. Yeah, significant tiredness, low energy, or problem sleeping. Yeah, detachment from reality. And when we are talking about detachment from reality, we are talking about serious mental illness like schizophrenia, paranoid schizophrenia, hallucination delusions. Yeah, which we can go into at another time. Inability to cope with daily problems or stress. Trouble understanding and relating to situations and people. Yeah. Problem with alcohol and drug use. Changes in eating habits. Again, excessive anger and hostility, violence. Yeah, sometimes we see that. And then also suicide is key. These days, children self-harm and suicide rates are very high. All right. One thing that I need to mention though is sometimes some mental illnesses present themselves in a form of physical causes, like a child will be talking about having stomach pain, back pain, a headache, or unexplained aches and pain all over. So it is the emotion being expressed in physical causes. So those are some of the symptoms. So you take the child to a GP, the GP says there's nothing wrong physically about this child, but the child continues to tell you they're having pains, aches, and all that. That again is a sign of early warning sign of a mental disorder emerging. So I think the list can be longer than that, but let's stick with that for now.
Right. Thank you, Mr. Dumenya. I'm going to try and summarize it as much as and you know me pacho me try na summarize and ya kind of quick in 10. Mr. Dumenya ne Chantel so almost say ye per se you as awofo early warning signs ne your friend early warning signs and new ma say yes sheni hu say bia yemba no omasesa ana bibi wo ho a enkosa na ekoda say you hu doctor entema ebi ne emotions, thoughts, any behavior into emotions yes na ebia akoda no min kan say any feelings ne na turn or expressing ne ho some ebia or ebia one ne kasa na wo kan bibi na adwen na eto baby for fra and if you su behavior ye ebia nia oye nkete na ebi no try say eto de bia wo ba o say enani yem ochina ne hwene ochina na so ochina ne ni o wo na ko doctor nyina doctor say hwenya akoda no eto de bia ya na ye bibi na ya akoda na eno ye signs that say ye hwehwe mu hwe say e de mpa na ya akoda na wontu minka what ne hwene ni yema ye hwa ye ma ne duro bia so enye no eno ye signs of mental health ni bia me hu hia say e hwehwe mu ni hu say. Sorry, there's a lot of feedback. I'm not sure where it's coming from.
Carry on, let's see.
Thank you. So eno ye nyo maybe say ye ma ye ko ni ye hwehwem efi so Mr. Dumenya say ye wo ebia eno de ya na edu echiri eno no na ya na ya mema ni din say schizophrenia eno no edian akese eno no de na che say ye du echiri but enim de na say ye hwe ni ebi ni say ebia akoda no de bia obeko school anu wusu enemi nko school hwin ni ho obisa enemi nko ochina me nko wode ne ho esie dem mu ubehu no wo twitwa ne ho ubehu na wo chese enyomo ye no wonti ase enti eyesa mesre mo twihwe mu na ade Chantal kan ye me say hu hia pa say yen ebibifo ya ade ba kwa yen nya ade ne say yentie yen ma akwadaa ne pɛ sɛ ɔka asɛm kyɛn yɛn no woyɛ deɛ na sɛ bɛsene na woyɛ akwadaa bɔne yɛ a yɛnya abotrɛ yɛnhwɛ ne ɛkɔ so ɛma nkwadaa no because yɛanhwɛ yie bi a na biribi na ɛyɛ akwadaa no na yɛnhu ne ntɛm na akɔgye nsɛm akɔyɛ akɛseɛ no schizo ne as ɔma start tete nsɛm nom ne adeɛ no adeɛ baako so ɔmo kaeɛ a ɛne sɛ nkwadaa start sɛ ɔmo nonom nnuru bɔne ɛno nso tumi ma ɛfa adwene anim no nti awofoɔ yɛma yɛni nkɔ yɛma ho why over to you.
All right, thank you very much. As I said, that Madame Ophelia is quite very good in the translation, and she does a wonderful job of it. Yes, we want to promise people that we want to finish on time, so we want to tell our guests that we've got a few things to get through, but let's be on point and as we get through, because we want to respect people's times. It's become a little bit of a habit that we go overboard a little bit. So let's look at the support available. And then quickly we want to add what are the barriers to those support. So as you look at the support available for people who are suffering from mental health or experiencing it, where would they go to and how can they access the support? And then let's look at what are some of the barriers. And if I can start with you, Chantel.
Sure. Okay, I'll be as succinct as possible. I'll try and be as short as possible. So in the UK, you have what's called an IAP service. So you have the ability, it's called Improving Access to Psychological Therapies. But this is a very short-term therapeutic service. So don't expect anything too long. Unless you're experiencing something like PTSD, OCD, social anxiety, like really significant things in terms of diagnosis. If you just got anxiety or depression generalized, you will normally have like 6 to 8 sessions. If you've got some of the more specialized things, then you're probably 12 to 20, 24 if you've got PTSD. So it's not very many sessions. And it's basically because it's free, if I'm honest. Then you also have like your doctors, if you wanted to get medication. I obviously don't just advocate medication just because of the practice that I have, but if you feel like medication was a good way to go, your GP is a good port of call. If you then have to be referred to a psychiatrist, your GP can then refer you to a psychiatrist. That is the main framework within the UK. Hopefully you don't get into secondary care and all that kind of stuff yet either, but if you do have to go into secondary care, if you did feel like you wanted to voluntarily section yourself, for instance, that is something that you can do. You can present yourself at a hospital, or you can speak to your GP and voluntarily do that if that is something that you feel that you need to do. People who voluntarily section themselves as well have the ability to leave whenever they want as well. So you go through your treatment, whatever else. If you then say, I feel like I'm okay, then fine. However, if you are sectioned and you're not voluntarily sectioning, you do not get that option, okay? In the US, the process is a little bit different, and it varies from state to state as well. So you would have to probably check for your state, but generally speaking, therapy should be available through health insurance, depending on your health insurance coverage. And you should also be able to, I think, access. There are some free services, but I think they're very, very hard to get a hold of. If I'm honest, both UK, US, I'm trying to think of places that I've worked with now. Canada, I think the main issue is the amount of time that you may have to wait. Especially in the UK at the moment, the waiting time is crazy. I'm not going to lie to you. There are people that are coming to me now that had applied for therapy sometime last year. So the waiting time can be very, very, very long. And in that time frame, obviously a lot of things can happen. But yeah, I think that would be the main barrier that most people say, like, oh, I waited so long for you and blah, 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 blah. And now you're only going to see me for 12 sessions, 20 sessions. I've waited for you for a year and you're only going to be with me for like 3 months or 2 months or whatever the case may be. I'd say that that's probably a big barrier as well. Probably underestimating how much you can get done in that time. But I do see it as a significant complaint as well, because I think the waiting time is a bit crazy on both sides of the Atlantic, if I'm honest. Less so in the US, because you could buy your way through if you really wanted to a private therapist. You can do that here too, but I think the mentality that we have in the UK is more so that it should be provided by the NHS in some way, shape, or form. But by doing that, it's just a long waiting game. But I think that that's the biggest barrier. I think also maybe our own ideologies around mental health and what will happen. I've had people come through to me for assessments and they're like, "Oh my God, are you going to section me now?" I shouldn't laugh, but it's true. Some people do. They genuinely like, "Are you going to section me now? Am I going to the hospital?" Or there'll be things that people hold back because they're scared that that's what I'll do. No, and that's something else to for your viewers as well. In the UK, in fact, both sides of the Atlantic again, you have to get 3 psychiatrists to agree, basically, that you need to be sectioned, and it's hard to get one of them to agree with themselves. So if 3 of them agree, there's definitely something wrong. So yeah, but yeah, I think that those are the main barriers that I can think of right now.
That tells us a lot about misconception about mental health, isn't it? If people come to you to say, "Are you going to section me?" when that made you laugh, and example also of the fact that people think they don't want to talk. So mental health in itself is not accepted in our society, and the more reason why this program is very important. There's nothing wrong with saying, "I am not okay today," and I think that's what people need to understand. It's okay to say, "I am not okay."
Absolutely. You want to bring Mr. Demenya in?
Very much, Chantal. That's a very little one, but I would like to categorize the help that are available out there for listeners to. Now we have primary care help, secondary care, and tertiary care. All right. Now, primary care is GP. Your first point of call is GP. That's your first point of call as family. If when you come across the early warning signs we've talked about earlier, and you want to speak to somebody, your first point of call is the GP. Sometimes the school health nurses are able to pick up some things, and then they'll draw your attention to it as a parent, and they'll make a recommendation as well. Teachers can pick up things as well. So those are the areas that you can get some support. There are school help nurses, there are schools that have some help services inbuilt in the school that support children. The secondary services, when a GP sees your child and see the child and think that this needs a further assessment, the GP would then refer the child to secondary mental health services. So this time, a psychiatrist or psychiatric nurse or a psychologist or a psychiatrist will get involved. And initially, they will do an assessment. They will do an assessment of what exactly is going on with your child. They look at the child as a person, what is going on in their psychological processing, as well as the social environment, what is happening at home and things like that. And they come out with a diagnosis or the problem, what's actually going on. Yeah. Then after that, they will formulate treatment plan. Yeah, the treatment can be some form of therapy or medication or maybe some advice and guidance they give to families to be able to manage child. Or sometimes the child can be taken to a special service for them to get involved and support the family to manage that child. So those services are there. I need to highlight them for you to know that they are there. So you don't need to suffer alone. There are services paid for by taxpayers' money. People are there, benefit from that service. So don't hesitate to call for help. All right. Now, when it gets to a different level, even within the secondary mental health services, when it gets to a stage where they think that the child will need a hospital admission, the child can be admitted as an informal patient, which is what Chantal was mentioning, get the self-section. Well, what she's saying is we have section 131, which is involuntary admission. So whereby the family agree that this child can be admitted and then treated, and the child is not fighting it. You know what I mean? But when a child needs help, and then the child is fighting that he doesn't want to leave the family, wants to go home, and the risk that the child is presenting to themselves or to others is great, then the Mental Health Act assessment comes in. That is where I mentioned my role. One of my role earlier is being an AMP. So myself, as an approved mental health professional, will go with 2 doctors. Yeah, one has to be Section 12 approved, which is a legal term. Yeah, so we will assess this child. with the aim of coming with a proper plan. And that plan could be that we ask this child to come to hospital against their will. So we can force the child from their parents, take them to hospital for them to receive the care. So that is called a mental health act assessment, sectioning somebody. So you have a section 2, which is an assessment, section 3, which is a treatment, and I like that. We do, that's one of my role I do as well. So that's what we do. But this is where I need to highlight. I said earlier that we wait, in our community, we wait till we reach that level where a child is sectioned to hospital, even with adults, when an adult is sectioned to hospital before we get the help. So we need to prevent that happening. It's not a bad thing to take somebody to hospital for them to get help against their will, because when we do that, it means we are managing risk, the risk themselves, the risk to others. That's when we take somebody to hospital against their will. All right. So that's what we do under the mental health service. There is a special service called Child and Adult Mental Health Service for children, and in that team we have nurses trained to work with children, social workers, psychologists, psychiatrists, occupational therapists, name the speech and language therapists, name everything that a child needs. They're in that team. So when we know early, they get involved and provide a service. Now, tertiary services is where Chantal and Co comes in, which is psychological therapy that goes into CBT, do a lot of intensive work on specific issues of that child. So in broad terms, in the UK, that's the services we have. I don't know what services are there in Ghana, but that's what the services are. Now, I want to quickly mention this website so that viewers who are listening can log onto the website. There are other areas of service that we can. It's called Nip in the Bud. Nip in the Bud. Yeah, can you write that one? Nip in the Bud. If you put that on Google right now, you get to a website, and then they can tell you all about mental disorders, science, and then the help that you need. So we have ADHD. There's a health service for ADHD. The numbers there to call. All the mental disorders, they are there. So barriers. The reason why we don't go to services, sometimes the stigma of somebody suffering from mental disorder in your family is a barrier to us, especially in our community, right? Perceiving problem as not serious, so we just trivialize what we are seeing with the child and say it's not serious. Sometimes, especially in our community, we try to beat the mental illness out of the child. It's not right, right? Reliance on self. Sometimes family try to manage it themselves. That's the barriers we face in our community. Difficult assessing help, like Chantal mentioned earlier, being on a waiting list. Yeah, but there are different categories of help. So primary, secondary, and mental, and tertiary. So I guess what he's talking about is the tertiary bit where people are waiting for therapy. Yeah, fear of negative outcomes. Yeah, especially in our community, there is a stereotype about how medication impact on people. They put on weight, they have a low sexual drive and things like that when it comes to adults. So people carry on those negativities and then refuse help that a child needs. So some of those barriers need to be broken down. All right. Difficulty identifying and expressing consent. Yeah, some families clearly have difficulty identifying the symptoms and then assessing help. So those are some of the barriers that I can give you.
Thank you, Mr. Dumenya. Quickly, because I know we are stranded for time. So to help our community, what are the first steps? And before you get to the tertiary, because you've gone into further details, that's why I'm asking. So when you suspect something is changing in your child, what's the first step? What's the next step? And what's the final step? Three simple steps.
Yeah, that's what I've mentioned. First, the primary, your GP.
Yeah, what would a parent do? Go to your GP, go to your school health nurse, what do they do? Quickly. So I suspect
they carry on an assessment. So everything.
What do I do?
Say again.
If I suspect there's something wrong with my daughter, what's the first step to do? Who do I go to first? Who? School, nurse, or GP? You know, because that's something.
You are a parent. I've said earlier, you are a parent. You have seen the early warning signs that we've mentioned earlier.
Yeah.
And now you are concerned. So who do you speak to? And I'm saying that every family has a GP. All right. That should always be your first point of call.
Okay.
I've also said that sometimes the school may notify these problems early and they'll come to you. The school health nurse can even refer to GP, all right? Sometimes social workers get involved as well, depending upon it. But the first point of call is primary health care, primary, which is GP.
Okay.
The GP services have nurses there. In adults, we have some level of psychotherapy based at the GP practice that people can access as a primary service. All right.
Okay.
The key at the primary level is to do a further assessment of what is going on with your child.
Okay.
Now, if the GP thinks that this is beyond a primary care, the GP would then refer to a secondary care, where there are specialized trained professionals like a psychiatrist, psychologist, psychiatric nurses, therapists there who a team comes together to support the child. It's a multidisciplinary team that will support that child. And then within that team, another specialist unit, which is the tertiary one, is where the therapy goes on.
Thank you.
The secondary assessment continues, and then intervention, that's where the therapist comes in.
Thank you. Thank you very much. Cool. 2 minutes. Enianom. Yeah, boni to na ne say emwa eho. Enti se wo bibia enti na se wo first point of call yenyina obia wo GP, obia register GP. Enti bibi na wonti ase a mesro entemara book appointment and afre wo GP na ne nkasa. Wo GP no ko na if you ono beboa na e follow se school hu bibi na omo frɛ wa omo beka se ko GP mesro ko GP nti nia ya kan no ma emre ntimi nko emu nyina but nia ye kan se emwa ewo ho nti entna se na ma endu time I just say ya frɛ doctor so mrafie no fa force no fa wo ba no enko to ayaresabia there bi mfiti ase na ko GP na ko emwa.
Wonderful. Thank you very much, our co-host, Madame Ophelia. So as we wrap up, it is important that our guests advise us about how we look after our mental health. So in your final words, we're going to start with Chantel again. How can we improve our children's and our teens' mental health, and maybe in doing that also improve our own mental health?
Well, there's usually that we talk about the 5 steps to mental well-being. That is usually our first point of call. So the first thing that we would say is to connect with people. So a lot of mental health illnesses or issues can cause us to want to withdraw, can cause us to want us to be by ourselves. And a lot of the time when we do the opposite action, it allows us to kind of break that cycle. So one thing that we would say is, definitely try and build on having good relationships, trying to talk to friends, family, as much as you possibly can. Even if it feels like, oh my gosh, I really don't want to do this at all. There's nothing about me that wants to talk to anybody. That would be the time when I'd say talk to somebody the most. Also being physically active. That's something that can help raise your self-esteem. Also, we know that there's biochemical changes in the brain that happen. So we know that there's a release of endorphins, sometimes dopamine as well, in terms of a rewarding system. When you see you're able to run 2K instead of 1K, or even half a K if you couldn't run anything at all. So then you also have that. Also things like learning a new skill. So there's research to suggest that if you learn a new skill, it can improve your well-being because it boosts your self-confidence. It gives you like a sense of purpose. It gives you an additional sense of purpose. And again, it's another thing that can help you connect with other people. Also giving to others. This is something else that there's research to suggest that we get a dopamine release. So a chemical within the brain, a biochemical within the brain that releases that kind of gives you like a reward system. So I don't know if anybody has ever given something to somebody, let's say, even if it was a beggar, like they said that they wanted to get food and you gave them food. Sometimes you get a specific feeling that comes with that. That is like your hit of dopamine. So doing stuff where you're actually giving to others. So things like volunteering, in this kind of pandemic kind of era, trying to help maybe older people get their shopping in, stuff like that. And just small acts of kindness that we kind of see are very useful. So even helping to offer someone, to help with a DIY thing, whatever, all of that stuff could be very useful. And then also trying to stay a lot more in the present moment. So very frequently I'll use this as an example. Depression tends to look at the past. So the things that have gone, the things that have gone wrong, and very much a concentration on what the things that have happened in the past. Anxiety tends to be a lot about what in the future. So what if this happens? What if that happens? Should this occur? Should that happen? Blah, 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 blah. So staying present and staying in the moment can help deal with that. And it can allow you to also try and put things into perspective. So if instead of running off with your what if, like thousands of miles down the road, if you're staying in the present, then you can start to think, okay, is this really going to be as bad as I think? Have I really gotten to the extreme example of, what it is that I'm thinking? And if how likely is that outcome as well? So there's one thing I do with all of my clients, so you guys can have this for free, is like, is this thing a fact or is it an opinion? If it's an opinion, it can go either way. If it's a fact, then it is what it is. Either way, you can't change it. Right? So if it's an opinion, you can throw it away. If it's a fact, you can't change it. So if you can't change it, how do you deal with it? So that's one thing that you can do in order to stay in the present moment. Some people might use things like mindfulness, so a way of breathing, like mindful breathing, taking slower, deep breaths, trying to kind of connect with your physical body. Some people might color. Some people might go for a walk and trying to take notice of the things that are around them. There's different ways of doing it, but I would say definitely trying to figure out your way of staying in the moment is a good thing. So I try to keep it simple, so I hope that's okay.
Wonderful.
Thank you. Thank you. Your last words.
Thank you very much, and that's very educative. I appreciate that. Thank you. And what I would say is to go back to what I've mentioned earlier. Mental illness, some have biological causes, organically, socially, stress, abuse, physical, emotional, sexual, trauma, torture, migration, lifestyle of parents, poverty, accidents. People have brain injury from mental illness from accident, natural disaster, divorce of parents, and all this to how we can improve our children and teens' mental health is looking at all these aspects of our lives. Yeah. Parents may divorce, but they have to manage the divorce in a way that it doesn't affect the children's mental health. All right. Social media, we watch our children, how they are looking at what images or what they are being exposed to on social media, and engage in conversation with them. Chantal mentioned earlier that we don't talk to our children. It's true, we don't. But we need to be more, we need to take time and get to know what they are doing. All right. There has been a lot of research these days about how children are being groomed online, even to the point of getting them to commit suicide or self-harm, right? So it's important we stick with that and then make sure we are involved in their access to social media. Drug and alcohol relationships needs to be watched carefully to maintain good mental health. Trauma, torture, these are issues that concerns us a lot when children are subjected to some form of trauma or torture. So this is where abuse, when social workers hear abuse, we don't sit well in our seats. We jump up and down. We want to see we want to see that child is safe. You know what I mean? We should address any form of abuse within our family to maintain child mental health. All right. Now, first, there's this thing that I want. There's this word or this acronym I want people to remember. New Start. New Start. If you can write it down, New Start. NEWSTART. Chantal has mentioned it. This is what I use a lot. In fact, in the church that I attend, we promote this a lot in our health program because we believe that the gospel, the right arm of the gospel, is a health message. And in the health message, when we are presenting it, we look at the health message in the form of nutrition, which is N, stand for N, nutrition, exercise, water, sunshine, temperance, everything, moderation, air and rest, and then trusting in God. So that's New Start for you. Write it down, New Start. So nutrition, what's your diet, food? There's a lot of research. I can go into, because of time, I don't want to go into each one of them and what the research says. All right. but we can look at it later if that is what is necessary. So nutrition, exercise, drink a lot of water, expose yourself to sunshine, get nature to your body, yeah. Take your children out, yeah. Make sure they drink water, get them to exercise. These children these days not exercising, they're all the time playing games on their devices. Let's get them out of the house to be part of nature, all right? Get them to drink water. Too much fizzy drink is not helping at all in their health. They're just getting bigger and fatter, all right? Let's control what they eat. Give them home-cooked food, yeah? I've mentioned sunshine already. Temperance, everything in moderation, nothing in excess, yeah? Do things in moderation, okay? Air and rest. Rest is important. I mentioned air, you need to go out. Rest, get them to sleep. Take their phones from them. Make sure they have the rest that they need. Children need rest to grow. And above all, let's have faith and trust in God. Because sometimes, like for example, biological causes of mental illness, you have no control over. All right? The biology, the child brain has not formed correctly. And you've got to care for that child to the end of their life. All right? I'm saying what we are saying is that there are services out there. Don't suffer in silence, but trust in God. You need people, the community around you, the church family around you, to be able to go through some of these things. Yeah. So that is my conclusive statement. New start. Remember that word, new start.
Thank you so very much. Kweku, can you please put new start for me? So I quickly summarize new start because that's very new start. New start. I can't remember. Yo, Edianom, ye de ane, ye de agro no abewie na ade ba kwa me pese mu nyina ye nyina ye di free ha ye nyina ye di free ha e kai ye ho ne say ade bi a Mr. Dumenya chen o say ye friend new start ade foforo ye fi ase foforo na foforo ne say we have lost it right but that's it. I'll say eduani nutrition near say ye madie enkoda babies abayuane ye mom eduani panni ye mom exercising na video game na adoso de biane yet ho na pre any video game ni phone edoso dodo ye mom no minsuo na fanta no endokondoko edu ensuo na ye de mankoda ne eno nye mom ye mom no minsuo na yenim say ye krom ha de wie ni ha de na emom ye ma yonkwa abontin kakra na ewo ho no eno nso omunya eye mo na temperance and no ne ho de em say kwekwe no ase ne saying
doing things in moderation.
Okay, enti bibia nkwada ne be ye no ene kakra say enye bibia ebro so enti game na ye bo game kakra ye didi kakra ye ha McDonald enye de bia ye friend McDonald enye de bia ne ye be die no ye mom nso enko ye ko walk ye home ni nyina na ye mankoda ne nso home na fi ye ntro mu nyamesem nti no ye di try to and say emoa wo ho se wo ba onti apo se wo hu enioma foforo se wo hu bibia wani nye ho a wo feel se me be wo ya yare a mesra wo GP wo first point of call na wo mwa and na se asori ye eminianum asori ye na emum enye ni nyina na nyame oba be ye ne wo ho na eto de bi ofani pass de bia na yakopon ofani passo inti yenko ye GP na yemfa mpaibo no so entire chi ma ye ntwen na yemfre a doctor for pimple ni yembetitwe yem ema no yemfa omonko ayaresa bia sesisi ade ate afaso why inti no eno an ye disimsi ha ye da mwase.
All right. Thank you so very much. Our super co-host, as everybody has said. Yes, we've run a little bit out of time, but this was important. And Gillian, thank you for saying that you are not complaining. Yes, so because the information is so important. Look, the information that's been given has been super. And I think that we should go back. Let's share this. Let's share the information with others. There are so many comments that are coming through. Yes, from the new stats and people acknowledging, well said, according to Trudy. Isha is saying, I agree, don't suffer in silence, please. Yes, a fantastic and very informative panel. Our outreach lead is agreeing. If outreach lead agrees, then everything is fine. And Lilia is saying that families should try and cook together. Yes, that's very nice. This allows children to come out and of their shell. Yes, and people are agreeing with you, Obaya. And yes, Irama is saying that's it. That's the approval, the seal. That and as she said, you are a super host. So this has become a regular thing now. Ophelia, you'll be coming back a lot now. So please clear your diaries. So we want to thank our guests. We want to thank them so much for coming through. Please, go into the chat section and say thank you to Chantel and to Mr. Dumenya for coming through and spending their time with us this evening and giving us all that wonderful information. So please make it a point. Apologies for a bit of echo. There was a little bit of echo going on around there. We tried to mute each other to try and resolve that, but hopefully you had most of the information. So please, thank you to our guests, and then we say goodbye to them. Let's start off with Chantel. Please, yes, put in thank you there. Yes. Keep the comments coming.
Chantel's job, is it the title?
Yes, the information. Yes, thank you very much for reminding us. I'm gonna bring that through again. Give me 1 second. Yes. So Chantel's is the
innovative
therapies, yes. And Isha Johnson's one is the luminous counseling. So we've got great guests who are offering great services for all of us. So apologies for the echoes again. So yes, thank you very much for all the oh wow, look at the comments that are coming through. There are a lot more comments coming through. Yes, thank you very much. Blessings there. Thank you. Coming from Isha Johnson. Yes, she's the one that owns the Illuminous Counseling. Oh, sorry, I missed this tonight. Yes, you watch it later. Yes, absolutely. Yes. And yes, new stats. Yes, another Dumenya there. Mr. John, you've got competition now. This is Dumenya there. And everybody's saying thank you. So we want to say thank you very much and bye for now. We're going to talk to you later, Chantel. Bye for now.
Thank you.
Bye. Yeah. Bye. All right. Can we also say goodbye to John?
Yeah.
Who's been super today. Thank you very much and goodbye.
Bye.
All right. Okay. So thank you very much. As we said that if this again, this is quite important. That if this program is brought any negative emotions or made you revisit something that from your past that is going to cause trouble, please don't suffer in silence. Contact some of the numbers up on your screen. Contact Gaswa. We will also try and point you towards the right direction. And thank you very much. And yes, there's more thank yous coming through. Yes, there's more thank yous there. We really appreciate that. Yes. So final words, our super co-host.
Very cool. It's been a wonderful evening for me. Messiah New Start. That's what I'm taking with me. I think it's good to know that there is help out there, even though there are barriers and waiting lists. At least you know that when you're on that list, you get help. And for me, I think our society and mental health are not good friends, and it's about time we embrace mental health. And as I keep saying, it's all right to say I am not okay. Yes, so Becca say na uhia mwane ntema ana uje mwane ntema na wenya mwano answer edu time ajinsem kra intino. It is all right to say I am not okay.
It is all right to say I am not okay, and that is absolutely true and absolutely the case. I want to share something very quickly with all of you before we go. If I could bring it on my screen very quickly. Yes, okay. So that is on the screen for everybody's information. Let me put it there. Yes, so as part of, we've announced before that Gaswa, we've been selected as a delivery partner to deliver information to, conscientize the community about COVID and the support available. And our Honorable Martin Luther King, Martin Asamoah, is the one going to do us the honors. So the date is there, the 7th of November. We will send and share the links on our platforms. Please come and support the program. We want to talk about the role, as it is there, the role of social workers in a pandemic and how we can help to help families to cope with this deadly disease. Unfortunately, the COVID numbers are going up, and this is a program that is being sponsored by the Community Fund, the Lottery Community Fund, and organized by the Ghana Union Midlands. And we are saying that please come and support us on the 7th of November at 7 p.m. Sharp. Please make sure that you note this and come and support us. Thank you very much for that. On that note, we want to say thank you very much. We'll be coming your way again. Yes, thank you. Look at all the wonderful comments that are coming through. Yes, thank you so much. Thank you so much. Thank you, guys. Thank you for that wonderful comments over there. We really, really, really appreciate it. So on that note, myself and my co-host Ophelia, we want to say thank you so much and goodbye. And we'll see you again, same time. I'll say that in a fortnight with another interesting program. So,
Gaswa, service to the community.
Absolutely. Goodbye.